Before I move on to our last sort of wrap-up question, we do have a media question. I am inviting Brittany Gervais from the Calgary Herald and Calgary Sun into our conversation, who had a question for our panel today. You are live, Brittany. Go ahead.
Hello, thank you so much for taking my question and for hosting this panel today. So I just wanted to get kind of an opinion from the panel just to see if this is something that you're hearing or if this is something that the province needs to be preparing for, might be concerned about. What we did see kind of an open letter circulating supposedly from healthcare workers who were opposed to vaccination mandates coming up. We haven't been able to verify this, but just brought up the question about vaccine hesitancy with Alberta's healthcare workers. So, they're having conversations in Ontario and New York about possible worker shortages that could come up if some people refuse to get vaccinated. So just wanted to hear if vaccine hesitancy among healthcare workers is something that you've heard, or if it's prevalent enough to be something that concerns this panel, and if so, how can or should the province kind of prepare to deal with more potential worker shortages?
I can start. Yeah, I'm aware of the letter, and it is extremely frustrating. And I do think this matters. It matters for a number of reasons. Number one, we know, and research tells us this, that people trust and listen to healthcare providers. Whether you're talking about nurses or physicians, you name it, a healthcare provider, they're trusted voices in this space. So even if it's a small percentage of people from that community, they can have an outsized impact on the public discourse. We know from a survey that the College of Physicians and Surgeons did very recently, I think it was 97% of Alberta physicians support the mandates and passports and the public health measures and vaccines. But this very small percentage, 3%, can have a really adverse impact. So it matters from that perspective. I think it also matters from the workforce perspective. I don't think it's as acute as in, say, New York, but you've heard ICUs are full, and any kind of work disruption can be problematic. But the other thing is that letter is full of misinformation, and just having that circulating in popular culture can do real damage. I can guarantee that tomorrow morning, we can come back and ask this, there's going to be anti-vaxxers who have sent it to me. Or it'll be on anti-vaxxer blogs, quoting that letter. And once it's out there, you can't pull it back, and it just does the damage. So that's why I think it's so important, like people involved in this call, that we get out there and we counter the bunk that is in that letter. And we make sure that we highlight that this is a fringe group of healthcare providers. Most healthcare providers need our support, and they're 100% on side with the public health measures that are required.
Dr. Bakshi, would you like to add anything?
No, I think I would echo everything that was just said. I think it's important to know that the college and various organizations around the province are looking at how do we work with the physicians that are spreading this misinformation. What does it look like to kind of talk to them, understand where they're coming from, but also to protect Albertans, right? So one of the important things that comes out of the college and the Alberta Medical Association is that our goal is to protect Albertans. And that means the health of Albertans. That means talking about misinformation and debunking all that misinformation, because as was just mentioned, it can do great harm. And so I think it's important to let Albertans know that this is being looked at from a provincial level, from a college level, and how we can make sure that the misinformation doesn't harm more people.
Yeah, and I think that overall for those healthcare workers who are actually in the ICU or in the hospital, on the wards, taking care of these critically ill patients, those are not the people who wrote the letter. Those are not the people who are taking care of patients. So I would just say, from my perspective, seeing that letter is just so profoundly disappointing that that's what they felt and the impact that a letter like that would have on their peers. And it just is so very disappointing.
Yeah, and I'd have to echo that I would invite any of those people to join me next week when I'm on the COVID ward for 5 minutes. And I guarantee you that most of those people will not.
I'll say the same, that my colleagues and the people I've worked with in ICU, and then my colleagues in my regular day job, everybody was super excited to get vaccinated. I've not heard of one single colleague of mine that has refused or declined the vaccine. And as president of the Canadian Association of Nurses in Oncology, we issued a statement requiring or calling for and supporting mandatory vaccination for oncology nurses and healthcare professionals that work with people who have cancer, because they're at significantly increased risk of adverse outcomes with COVID infection. And from a legal standpoint, I've spoken with the Canadian Nurses Protective Society about the legal aspects of mandatory vaccination for healthcare workers, and legally there really is no legal argument against mandatory vaccination imposed by employers. So it's disappointing, and in preparation for today's talk, I spent some time debunking some of the misinformation in that letter, and also there were two pediatricians who'd written letters recently as well, with a lot of misinformed claims about vaccines, and I did a lot of reading over the past few days to prepare myself to address those questions should they arise during our talk today.